If a patient is on these medications, the guidelines that we have from OMS and other organizations do discuss what's called a drug holiday. So let's say you have a tooth that needs to be extracted and you're searching for a provider to do that. I think one of the best providers to do so would be an oral and maxillofacial surgeon, simply because of their advanced training in dentoalveolar surgery, which is extracting teeth frequently, and they're going to manage that wound very well. As part of that, they may recommend what's called a drug holiday. And so you might stop taking that medication for 2 months prior to extraction of the tooth, and then you'll stay off that medication until the mucosa heals, the bone heals, and everything is confirmed to be healthy, and then resume your medication management. There are some conditions where we don't want to stop your medication, and so that medication is never stopped without consulting the physician who has prescribed it, whether that is your primary care physician or an oncologist, because sometimes there are more important things than osteonecrosis, and we can manage that risk fairly well in a good proportion of patients. So if you're taking a drug like an anti-resorptive, like Fosamax, for example, for osteoporosis, the absolute risk of osteonecrosis is somewhere around 0.01%. So it's not a very high risk, and so we may be more accepting of that patient staying on the medication because the risk is so low. We may also stop that medication because, again, the risk of an adverse event being off the medication is also low. In a cancer patient, it's a little bit of a different story. The oncologist may not feel comfortable stopping that drug because it may be essential to their cancer treatment. The risk of osteonecrosis with an IV form of the drug, which is usually what's used for cancer therapies, is somewhere around 1 to 5%, in some studies up to 10%. And the greatest risk is when you extract the tooth. So again, consulting with an oral and maxillofacial surgeon who understands osteonecrosis and is going to work with your physician to appropriately manage those medications and manage that risk is really essential.